So this is Dharma in the back of the room. This is Leonard. He wrote the book that I just showed you, and he's more than happy to give it out to you guys, and it's I think, very good. Caroline, who's helped me with this project as well. So Dharma's the guy that I was introduced to by my patient who, like I said, very well-known hemp grower up in Sonoma area. I know he stands behind a lot of really good products. I've known him for a while, and he was one that I said, hey, where do I go to? I want this product. I have no idea where to look or what to do, and I don't have, I can't figure this out. And he said, call Dharma, he's your guy. Talk to him, he'll know. So I called Dharma, and Dharma said, what do you want? Let's talk about it. And I said, I want something that's gonna help, she's my paid best friend, I called her. She's my therapist for years and years and years, and she has since retired and is now my no longer paid best friend, just a good friend. But anyway, Karen needs a new product where she's not spending $200 a month to help her with this. And Greg says, you're my guy, can you help me out? And he said, yeah, tell me what you need. And so we started down just this little path. He'd send me something, I'd be like, no, not quite that. That's not quite what I think. No, not quite that. Anyway, we landed on a nasal inhaler, which the goal was really to improve her sleep. And I passed it out, to my team, because everybody's team's their guinea pigs, right? Here, try this, I learned something new. Here, try this. So my team of 10 all got their stuff. They took it home to their family, and they were like, God, you're on to something. Not only did I sleep better, but I actually could breathe better. And I don't know why it didn't occur to me to ask Dharma when I started this process, give me something that helps clear out the, airway as well. Just wasn't thinking. So I think we got lucky with that first round, that was a side effect, and then I went back to him and said, hey, you know what, we actually want to improve nasal breathing too, that'd be great, sleep and nasal breathing. So we came up with a product that went through a few iterations with the goal of improving airway health, reducing inflammation, and helping improve better sleep cycles. Again, my entire incentive for this was just to make my paid best friend happy, right, because she keeps me happy. So we ended up with this product, which was far more than I ever anticipated or thought it would be in terms of rewards and benefits that I was seeing with people and patients. So we took it a little further. We took it to a group of our colleagues and said, hey, you guys want to pass this out to your patients? Let's get a little trial going and see if we have something here. And so we got a group of dentists and we gave them the advanced formulation. We gave them directions, mechanism of action, how easy it was to use. And these were the things we were looking at: anti-inflammatory, anxiety, muscle relaxation, neurological regulation. So we did a little case study, which doesn't quite count, but again, we're just kind of getting off and getting started. But we had 52 participants, so this was just recently done. 120 survey submissions, only 2 people dropped out. 82% reported symptom improvements of their primary symptoms, which were anxiety and stress, brain fog, headaches, sinus issues, and sleep issues. Faster action than any of the other products they were using, and ease of use. So that's what we ended up with. And the company's Healing Essence is Leonard's company, and then we created our own product out of it. But these are the products, within it. We've got CBD for pain relief and anxiety, CBG, anti-inflammatory pain relief, neuroprotective, antibacterial, CBN, which has analgesic properties, anti-inflammatory effects, neuroprotective, antibacterial, KCA, which is not psychoactive, has several potential benefits also, which are listed there. So we're creating the entourage effect, and we're adding in essential oils, depending on we have 3 different ones, depending on what we're trying to influence, whether it's mood, cognition, or sleep. We've changed out the different oil compounds for aromatherapy, and we ended up with these 3 issues. So it's medical grade quality. That's another thing when you're out there, shopping at the store. One thing somebody once told me is you don't want to buy your sushi at the gas station, right? You don't want to buy your CBD there either. Price point, if it is too good to be true, it's probably too good to be true. You want something that's created with safety in mind, that's distilled properly, that's third-party regulated, so you know what you're getting, because this is not FDA regulated. There's no big governing agency out there making sure you're getting what you think you're getting, so you want to make sure the company you're working with is ensuring you're getting what you think you're getting, including safety and quality. Anybody can try to distill something, but hemp in general is what we call a hyper accumulator, which means it's picking up stuff from the soil. So if you're growing it in soil that's full of lead, arsenic, you know, gas, whatever, that's what you're getting in your products. You want to make sure that the soil is good, the distilling process is good, that the levels are what they say they are. So you want to make sure you're working with a reputable company. Those are the 3 different ones that we ended up making. If you're interested in finding out more, I think that takes us to the website that was developed. And I think I have one more slide. Yes, so what I do for my patients, and for, you know, whoever, the first 20 that comes and gets a thing from Dharma, I'll give you one of my packages that I give my patients as a gift. My pleasure to help y'all out. So I'm using this quite a bit for just sleep and breathing. Like if I get somebody an appliance, or I'm working with them on that, yeah.
I'm curious what your age limitations are for those.
So I would be cautious of that, and that's a good question for Dharma. Myself, I prefer to be conservative because we don't know enough, in my opinion. So I say 18 and up for sure. I personally hedge for 21 and up, not because it's going to do anything psychoactive, they're not going to get drunk, anything like that. We just don't know, I don't think, the whole story yet of what we're talking. So that's for me, and I wouldn't use it in a pregnant woman. Again, other medical practitioners are out there advocating the use of this in kids and pregnant people. They're saying it's perfectly safe. That could be completely true. I'm very, very conservative in what I recommend, just because, I don't know. But the sleep stuff, so yeah, I've had a lot of ask, and you know, this is something that maybe Dharma and his colleagues would like to look into. I've had a lot of ask to be part of clinical trials for kids with this. I just don't know enough, so I'm not comfortable putting my name on that, but it doesn't mean it's not helpful. But for my adults, if I'm doing appliance therapy, or I'm doing through sleep breathing, they're leaving with their appliance, or whatever it is that they're leaving my office with. They're now also leaving with a 2-week supply. I give them, you know, I'm trying to encourage all these proper health sleeping things, like the low temperature in the room, no screen time. You know, they get their little tip card, they get their eye mask in case, you know, it's not dark enough. They get 2 weeks of mouth tape, they get their nasal stick, and they get either my nasal band, or I'm a big fan of another company, which I guess it's safe to say because we're after CE hours. I like Intake's system, and so if you come and get this little package from me, I'm giving you the Intake one, which is not my product. I think it's a huge innovation. If you guys haven't looked at it, it's where you have a little magnet on each side of the nose, and it's a clip, and it pops you open, because I have collapse issues. Hands down, like one of the best things I've come across. I wish I had invented that. But anyway, so my patients are going home with this along with the nasal stick. So I'm happy, like I said, I think I brought 20 of them. If you want to reach me, there's my up and coming website, and then my email right there. But happy to take any questions that I might be able to answer.
For patients who are recommending like clear or nasal irrigation, where you do this immediately after, is there time when you irrigate and when you apply it?
I am recommending it as soon as they feel clear enough to breathe it in. So like for me personally, I love clear, absolutely love it. So I use that all the time. I use it first, I wait just a couple minutes, and then just right after that. You know, I just want, the better, you know, you can breathe in, the more, if you think about it, you're accessing the mucous membranes, you're opening things up. So I'll use either the 3-blow technique or clear or something like that, and then I'll do this after.
I have a question. You specifically mentioned at the beginning a long open mouth dental procedures. I have a patient that is very timely because he seeing a new dentist for a very long 2-hour procedure. They recommended midazolam the night before and the morning of, for which he has to pay an extra $500 for sedation dentistry. So he asked me, is there anything else I can do? So is there something you can do for a long open mouth procedure among your tricks here?
Well, this is more for muscle discomfort and pain. I mean, I use triazolam all the time. If somebody needs something, I don't charge them $500. I give them the like rundown and a prescription and a signed consent and a driver. But yeah, so I use a combination of it. But for my patients, I mean, for anxiety, yes, but it's not necessarily going to work like on the spot type of thing. So maybe a 2-week lead up. And then I like I have a cream and a roller ball. Actually, I think we might have the roller ball here too that I like for the muscle pain and strain. It works really well. So that's mostly what it means. It's long open mouth for. Anybody else? Yes. Oh, yes.
What time of day do you recommend taking CBD for the anxiety or
Great question. So it turns out, at least from my reading and understanding, that so for sleep and anxiety, there are certain compounds that help promote it per se, but not necessarily. So I believe the mechanism of action is more to calm your system down, bring you homeostasis, relax, let your body relax and sleep. But for certain people, the compounds can be stimulating. So like for me, it works great to take it before bed. I actually have no issue. It helps me go to sleep. It helps me breathe better. I am quite comfortable. There is a small percentage of the population, however, that it might be slightly stimulating, in which case it's better to take it in the morning and like at noon, and then have the residual effects over there. And that's one of the things about using these cannabinoids. Again, there's no overdose limit, there's no toxicity level. Some people's systems are more responsive than others, so a little will go a long way. So it's kind of a self-titration period where I recommend a low dose to start with for, a week or so, and then up it a little bit and up it a little bit. But if you're doing it at night and you're like, God, I really feel like this, I feel better in general, but I'm not really getting to sleep all that much better, then maybe, bump it away from the nighttime time. Yeah.
Is it better on an empty stomach or with food?
I have not had an issue with an empty stomach at all. But I'm also not typically, tinctures will bypass that system, right? I'm not a big gummy person. I don't really like gummies. So I don't know on that answer. That might be more effective.
Is there a test for, or how do you know if somebody has an endocannabinoid deficiency?
Yeah, as far as I know, there is no test for that. That is something where, again, it can be inexpensive and easy to see if this is beneficial, and there is no negative side effect to it. Because you hear that, like my mom, really bad arthritis, super beneficial for her. But then I'm sure y'all know people where it's like, I tried that. So.
There seems to be a different response from different people also. I know we had a friend who was dying from pancreatic cancer, and it helped her enormously. It just put it on her wrist.
Mm-hmm.
With myself and my wife for muscular problems and after her surgery with the shoulder, it didn't seem to help at all.
Yeah, again, I think it just depends on if you have the issue, that this is aimed to help with. But yeah, I find the same thing.
You do.
But I do find a good percentage of the patients I am getting a good response, and the ones that I'm not, I feel good that we at least tried it and it didn't cost them health, time, much money.
I just wonder if it could be placebo,
It probably could, just like a lot of things, right?
but why not use it?
Okay, well, if you want to come learn more, again, I know what I know, and that's about it. If you want to talk about airway and sleep, I'm your gal too. But Dharma in the back there, he's got a table, and he's the wealth of knowledge and resources. It's just, if it's something you want to learn more about, it was very beneficial to me, my family, my patients. It's easy to do. It's kind of fun to learn about. It's science. All right, thanks. Thank you.